Canadians too quick to reach for medication? People don't suffer in silence like they used to before. Statistic Canada tells us that 80% of people who suffer from mood or anxiety disorders reach out for treatment. But when you look deeper at the numbers, you see that 50% of people look for medication treatment only. People that look for therapy only, you're only at about 7%. So it tells us that people are very much willing to try new medication, more so than to talk to somebody about their problem. Too often, I think the first stop when we have an issue is our family doctor's office. And I don't know when's the last time you sat down with your doctor and had a long heart-to-heart chat with them, but it probably didn't happen too recently. The fact of the matter is that when we go to the doctor, you're lucky if you get 10, maybe 15 minutes to talk with them. And when you go see a doctor, you know they're gonna reach in their bag of tools. So often the tools that they reach for are medication. So a bunch of people get started on a bunch of medication when they haven't even tried therapy before. I gotta say, I think it's backwards because the risk associated with taking a new medication are so much greater than the risk associated with talking to somebody. I'm not gonna spend too much time on psychiatric medication side effect, but they include everything from headaches to dizziness to memory issues, sleep issues, sex issues, weight gain issue. You know, the list is long. You even have like thoughts of hurting yourself or hurting other people included in that. Those are side effects for very common medication, like antidepressant drugs or anti-anxiety drugs, drugs that are commonly prescribed. Isn't that nuts though? That we're willing to take such big risk just in order to escape having to talking to somebody about our issues. It's like we're only trying to mitigate the symptoms and we're not trying to get to the root cause of the issues we're dealing with. That's where I think therapy has kind of an edge on medication assisted treatment because we're really digging deeper and not trying to mask the symptoms, but understand like why you are that way and you know what you're gonna have to do to change. What's the worst side effect of therapy anyway? You know, you may feel some shame or embarrassment. You might even be judged, you know, if you get a bad therapist. But, you know, those pale in comparison to what I read up earlier. Truly, it should be a no-brainer that before stepping up to a medication-assisted treatment, it'd make a lot of sense to try to a therapy approach, you know, try to modify our behavior or process things that we're thinking about. And that's what we try to do in therapy. We try to talk about your life, maybe what's happening now, maybe what's happened before, but try to understand how you got to be this way and what you could do to move forward in a new, improved fashion. I'm not gonna lie, it takes more effort to go through a therapy than it does to take two pills in the morning. The difference though is also very significant, you know, because with therapy you can actually grow, you know, you can develop yourself into a better person and you can process stuff and actually leave it behind you. With therapy, you can achieve real personal growth and development, you know, and of course it's not easy and it takes time, but when you consider the time that a lot of psychiatric medication take to start working. You know, it can take up to 2 weeks for a med to kick in. Also, you have to consider that getting off that medication, if you plan to do so, you know, in the future, that's also going to take several weeks too. So in reality, there's no quick fix or easy fix for deep-rooted issues. In some way, we did it. People don't just tough it out and suck it up like they used to before. You know, they reach out for help. I just wish that in the future, you know, as a culture, we can make it normal to reach out for therapy and to get like a little tune-up session once in a while to talk about what's really been on our mind and things that are bothering us. And if we can normalize that, I think it's gonna help a lot of people. And I'm not sure exactly if it's going to help reduce how much medication the average Canadian is taking, but I don't see it hurting either. We have to normalize seeking therapy and making it you know, as normal, as regular as getting a haircut or a massage when you need one.